we're trying to do a town telehall and a Facebook Live simultaneously. So let's just hope this all works out okay. But as Jeremy mentioned, I was in D.C. last week for a few days. I'm here in Amarillo again, back in Amarillo today. But I was in D.C. I think Tuesday through Friday of last week. I spent most of the day on Friday up at the White House. I did see the president, the vice president, and several members of the task force and discuss some of this stuff with them to kind of catch up with where we're at and get a face-to-face update, which I think is important sometimes. I'm staying in touch with the White House every day on telephone and via teleconference and email. So I'm keeping up with what's going on. And I just want to let everybody know, we'll just start off, I guess, nationally, we're at about 374,000 cases. We're at 12,000 deaths approximately nationwide right now. And I know that sounds like a lot. And of course, 12,000 deaths is tragic, especially for the families of those people. And, we definitely feel for them, and our prayers are with them. But I just want to remind everybody, we have this kind of stuff that happens, and I'm not comparing this to the flu, but the flu does take 30 to 60,000 lives a year in the United States. So I think that we have a handle on this. I think the president's had incredible leadership on this. He's got a fantastic team around him. I know this team well. I've worked with them for a long time at the White House for 3 years. I worked in the West Wing every day, side by side, and I was involved with a lot of the planning for potential pandemic issues involving the White House in particular and the executive office of the president. So I know all these people that are working for him right now that are on the task force and the national security staff, the academic institutions that are in the area, Hopkins, the CDC, the FDA, Homeland Security, Department of Defense, HHS, Health and Human Services. And this is really a team as far as this goes with infectious disease. So quick update on some of the stuff that's going on. We have the new Abbott tests that are out now, and that's going to be huge for us. Those are being pushed out all over the United States right now. That allows you to get a positive test within 4 minutes and a negative test within 13 minutes, which is key in finding out, like if somebody has it that's a first responder, somebody in the hospital, or somebody that's really sick and we need to know right away kind of what's going on with them. This is key in being able to figure that out. So we have that out there now. That's in addition to the lab tests that have been out for a while that use the same type of PCR testing. So some of the labs have had that for a while in the CDC labs and some of the public health labs, but those tests generally require 24 to 48 hours to get a turnaround on those. So these Abbott tests are going to make a big difference for us, and those are being pushed out everywhere by the thousands and thousands every day. Now, I know we don't have a lot here in the Texas Panhandle right now or in North Texas. I'm actually working on that as we speak, see if we can get some of those. The reason is because they're going to the areas that they consider to be hot areas in the United States, and thank goodness that we are not considered in that category right now. And I just think that we need to work hard so that we don't get in that category, and I don't think we will. I'll get to more of that in a minute. But we have those tests out. The good news is that next week we may also have an antibody test out, and that may be as simple as a finger prick to test and see if you have the antibodies to the virus, meaning that you have been exposed to the virus. And that'll be huge for a couple of reasons. That'll allow us to start potentially testing folks and seeing if we can put them back to work. And knowing that someone's been exposed to it, that they've already had it, we can infer from that that they have a certain level of immunity or that they have immunity, and we can effectively allow them to go back to work and get our economy running again. So that's going to be key. The other thing it does, too, is it allows us to find out who potentially could be a donor as far as convalescent antibodies. Those are the antibodies that form in your body after you get the infection that circulate around your body and kill the virus. Those antibodies will hang around in your body for long, long periods of time. And there's a way to, if you give blood, to harvest those antibodies from your plasma and give them to a critically ill patient so that they can recover from the illness and potentially save their lives. And it's a great therapy that's been around for a while and other things. So we're looking forward to that potentially as one of our big advances as well over the last few weeks. We're working really well right now getting masks and PPE out. Once again, I say this knowing that the area that we're in right now is not high on the priority list. But like I said before, that's a good thing in a lot of ways. But we're getting that stuff out. That stuff every day is more and more available. And soon we'll have everyone will have as much of it as they need. And I think that won't be too long from now. In addition, the CDC changed the rules on masks, and I just want to make sure everybody's clear on that. The recommendation is that you can cover your face, that it's recommended that if you go out, especially if you're in close proximity to other folks, this really makes a big impact in areas like New York and stuff where people share public transit and they're in close proximity on elevators and the high rises that they live in and things of that nature. And what it generally does, the main thing it does, in my opinion, that prevents spread of the disease is it prevents you from touching your face as much as you normally would, in particular from touching your nose and your mouth. That's the main way that this virus is spread right now. Someone who has it coughs, it gets on a surface somewhere, someone touches it with their hand, they unconsciously touch their nose or their mouth, and they incubate themselves with the virus, and that's how they get it. Having a mask on, or not even a mask, it's not even recommended as a mask now, it's just any type of covering over your nose or your mouth when you're out in public can prevent you from doing that. And, I'm not doing it right now because I'm in my office. It's just me and Jeremy in here together. And, and we're separated by a little distance here. So it's not necessary to have one on all the time, but if you do go out and you're in a public place where you might be in close proximity to other folks, it is something that you can consider doing, okay? The other thing is the medications. There are a lot of good medications that are being looked at right now. One of the things that the president's done that's been just fantastic is he has created a huge collaboration between private sector, the public sector, and the academic sector. And that's never really been done before in this fashion. Everyone's coming together. It's really opened things up to public sector genius. And I think there's so many people out there that are just brilliant in these areas that are looking at all these current medications that are already on the market that we already use for other illnesses, and they're testing these to see if they're potentially good for COVID-19. The good part about that is that most of them have already been vetted as far as their safety because we've given them for years. The hydroxychloroquine is a perfect example. That drug's been around since 1940, so there's been billions of doses of that have been given out. And as such, we can infer that, that it's for the most part safe, and it is. So if we can just determine that it's useful in the virus, we can get it out much quicker than we would if it were a drug that were just being developed. So that's where the focus is at right now, going with the existing antiviral, antibacterial, and other types of medications that we think may have some impact on this, and really checking to see which one's going to be the one that hits the home run. And I think that's coming soon. Talk about vaccines. Vaccines are something that aren't going to do us a lot of good right now, honestly. They're rapidly being developed, but just by the nature of things, we're not going to have a vaccine until sometime next year. That's just the way it is. But the president has removed a lot of the regulations and standard operating procedures that really slow vaccine production down. So we will get a vaccine. It will be a really good vaccine, and it'll be developed rapidly, relatively speaking. But that's something that we can look forward to if this comes back in the fall. I think one of the other good things we learned about this virus recently is that it doesn't look like it mutates very much, whereas we have to have a new vaccine for the flu every single year because the flu virus mutates so much that every year we have to develop a new vaccine for it. It looks like at this point that if you get this virus, that you will have some type of immunity for a long period of time, which is really good news for all of us, right? And that will allow us to develop herd immunity rapidly, and it will probably prevent this from coming back as rapidly as it would otherwise. And if it does, it won't spread near as fast as it did. And I'd just like to reiterate as well, I know that there's all kinds of reports out there. There's a lot of false information out there. I encourage you, if you really want to get the information about what's going on, just go to coronavirus.gov. That's the site that's been set up by the task force to put out just the facts as we know them. But there is a lot of false information out there, and I would just encourage you not to spend too much time worrying about that. This is we look like we're on the downside of the curve in some of the areas that have been hit hardest, and we're hoping that that's what's about to happen in New York, that we're on the backside of that curve. I'm just going to give you my opinion on this, and I don't have any scientific evidence to back this up. But like I said, I've always said from the beginning, I think that this is going to be a seasonal virus, and I mean that as the spring, as we get into late spring and early summer and the temperatures warm up here, this is going to be a virus that falls off, in my opinion, okay? Now, I hope I'm right about that, and we won't know for a few more weeks if that's the case. But I think what's happening is this is hit the east coast of the Northeast, New York and New Jersey, particularly hard right now. It started out on the West Coast in Washington State, and it spread a little bit into California. There's a few areas in New Orleans and Florida that have taken off a little bit. But what I think is going to happen is that as this ends up dying off in those areas because of the social distancing that's going on in those areas, which is working, by the way, I think it will spread a little bit outside of those areas into other areas of the country, and it will come our way. It will encroach upon Texas. But I think what will happen is, if we're lucky, this is going to die out based on the seasonal nature of it before it has a chance to get here and really take hold. And I think personally that we're going to be spared from what we're seeing in areas like New York right now. I don't think we're going to see that even in our bigger cities in Texas right now. So let's just keep our fingers crossed. I think that's the way we're headed right now. Let's see. I think I'll wrap it up right now. I'm sure we'll have lots of questions that'll lead to some other discussion here on some topics I may have missed, but I'm going to turn it over to Commissioner Miller now. Thank you.